Hi, my name is Samantha Pear, and I will be presenting today on the barriers of clinical trial enrollment in cholangiocarcinoma patients. This research was done in conjunction with the Cholangiocarcinoma Foundation, and I'll be presenting today for the Western Region Public Health Training Center. So first, to give a brief overview about cholangiocarcinoma, it is an aggressive form of bile duct cancer, and there are several different subtypes. So the first one is perihyoid cholangiocarcinoma, and the incidence rate is 1 person per 100,000 in the US per year. And then there's intrahepatic cholangiocarcinoma, and that incidence rate is 0.7 per 100,000 per year in the United States. So this is an extremely rare type of cancer. However, they are finding it to become more prevalent as years go on. It's also typically extremely challenging to diagnose. So I think that there could be additional cases that are just misdiagnosed or undiagnosed. And as mentioned here, there are over the past 30 years, there has been an increase in the incidence in this form of biliary tract cancer and an increase in the intrahepatic mortality. So there are rarely ever clinical trials available to the patients who have cholangiocarcinoma. And so it was important to me to be able to look into this and see why some of those patients were not eligible for clinical trials, or if there were just not enough access to these clinical trials. So again, to continue with the background, it is an extremely aggressive form of cancer. Typically, it is late onset as well as advanced staging. So typically diagnosed at a stage 3 or a 4 cancer. There are very few treatment options. There are chemotherapy and immunotherapy options, but again, there aren't very many innovative collaborative methods such as these clinical trials. And the goal of the overall study is to evaluate the clinical trial enrollment as well as biomarker or molecular testing and the barriers that limit this. So first, I'll touch on the patient epidemiological and the clinical characteristics. So there are a few graphs and tables on the right depicting what the total population was for this study. To go over how we got to this patient population, this was a group of 204 patients and caregivers through the Cholangiocarcinoma Foundation who filled out their annual report. So 56.9% of the population are currently being treated with chemotherapy and 25.2% with targeted therapy. Those are our most common percentages. And 37.3% receiving insurance from an employer, 35.3% from Medicare or Medicare Advantage, and only 1.5% are not carrying any insurance at all. So it's important to understand how financially our patients will be treated and what types of treatments that they're already receiving. So like I mentioned, this information was collected in the 2021 Cholangiocarcinoma Annual Conference, and it was a SurveyMonkey survey that was created and shared with the patients and the caregivers. So first, to go a little bit into biomarker or molecular testing. This is testing that a biopsy can be pulled from, and it'll be matched up against genetic biomarkers to see if there are any specific treatments that are known to work better than others. So we'll see that about 77.5% of patients taking the survey have received a biomarker test, and also who that biomarker test was requested by, primarily the treating oncologist, but there were very many times, as you can see on the far right-hand side of the second graph, that many of the patients had to advocate for receiving the biomarker test to begin with. And then continuing on into clinical trial enrollment, 77.5% of the patients received biomarker testing and only 27% enrolled in clinical trials. 34.8% were unable to be enrolled due to actionable mutations, and 17.4% due to the presence of non-measurable tumors. So looking at some of the graphs on the right, it shares who has been enrolled in a clinical trial. Very many people have not. For those who were enrolled, how many? Was it 1 or 2? Primarily, if you are enrolled in a clinical trial, it's typically only 1. And as well, the patients that were told that they were not able to participate. So many patients are not ever able to participate in clinical trials. And as I mentioned, there were some of the actionable mutations or the non-measurable tumors. Those are some of the reasons, but also another additional reason to not being able to participate is prior use of certain chemotherapy drugs or immunotherapy drugs. So this is often also not allowing for patients to participate. So in conclusion, recent clinical trials for certain biomarkers that are listed there showed significant improvements in the patient's overall survival. So these clinical trials would be greatly recommended, and hopefully they'll be able to advance to the phase 3 portion of the trial, as well as FDA approval, so that they're going to be prescribable treatment options. There is an approval of 3 new targeted therapies, and even still the enrollment rate in these clinical trials are low. So the goal here is eventually to open more clinical trials, be able to expand access to patients and programs, and design clinical trials for patients without actionable mutations. And hopefully we can also safely expand our inclusion criteria so that more patients are able to enroll in clinical trials and receive one of these forms of innovative care. Thank you.